Calder, what are some of the most common types of medication errors that occur in surgical settings, and what factors contribute to those errors?
Sure. Fortunately, there's a lot that can go wrong with medications if medical professionals are not being careful. First and foremost, provide the wrong medication. And even if it's the correct medication, it could be the wrong dosage or administered at the wrong uh, route, administered incorrectly. Whether it's the wrong uh, medication or not, it could be a medication that the patient's allergic to. Certainly, if it's the wrong one, they could be allergic. Or even if they intended to give that medication, they could have overlooked or misunderstood a note in the patient's chart that they were allergic to that medication. And the way these things happen are, not being careful with commonly named drugs. It's about not communicating effectively between the team as to which medication we're administering, how much and where. That can happen by rushing, by sloppiness, by fatigue, by being overworked. Um, or it could just happen by not having the proper policies and procedures in place, or simply not following them or skipping steps.
Beyond just the physician, or, the doctor, maybe doing a surgery, what role do pharmacists and nurses and other members of the surgical team play in preventing those types of medication errors during surgery?
Yeah, so each member of the surgical team has its own role and responsibility. And overall, what they do is they serve as a checks and balances on each other. That not only are the surgeons and the anesthesiologists ordering for certain medications, the pharmacists are checking those and making sure they're not contraindicated, or that the patient's not allergic to them, or that you can't give these two medications together and that the dose is correct. The nurse is making sure that the right amount of medicine goes into the vial or into the bag to make sure that the patient's getting it, and make sure they're getting it in the correct way. And by all working together and communicating effectively, they ensure that even if there was a misunderstanding or a slip up along the way, that it's caught. And when they're not communicating effectively and not checking each other's work, that's where these errors happen.
What are some of the ways, procedures that are in place at hospitals that are intended to prevent medication errors in the operating room, and how can those failures in those systems lead to a what's called a never event, so, something that should never be allowed to happen?
Yeah, so like I said, when these checks and balances are not working against each other, when the team's not cooperating or communicating effectively, that's why this should never happen, because there's so many policies and checkpoints and checklists in place that this should never occur. And it should also never occur because the effects can be so dangerous and long lasting and catastrophic. And they break down when someone's not doing their job, someone's not being careful, or the team is not communicating effectively and following the policies and procedures that are in place for a reason.
You mentioned before that medications can have like similar sounding names. There's so many medications out there. They can be similar sounding. There's also the like a brand name of a medication versus a generic name for that same medication. So there could be mix-ups there. Are there like, do the medications have barcodes on them, and do they have to like scan those barcodes and then match them with something that's on the patient's record or anything like that?
Yes, they absolutely have that. There's also color coding for certain categories or types of drugs. And then there's also just the medical professional reading it on top of all of these safeguards that compound upon one another. And what you have is people just blowing through those, ignoring the alert that pops up on the computer when they scan the barcode and let it in, or the pharmacist not checking what's being written even though it's coming across their desk.
In a case that's involving a medication error during surgery, what types of evidence are most crucial for establishing negligence and determining liability?
Yeah. So the most important thing is first going to be the patient's medical record, and not just what's written on the medical record today, but the metadata of when that was added or changed, to see if anything was changed after the fact or not added until we know what happened, to see if people are writing a different narrative to cover themselves. What we also look at are the separate from the patient's medical record is the record of when that medication was ordered and when it was sent to the pharmacy, and that the pharmacy reviewed it, and then that it was sent up, and then that the nurse pulled it out of it's called the Pyxis, is basically a medicine cabinet which is locked, that they pulled it out, and what they pulled out and how much they pulled out is all a separate record, separate from the patient's medical record, that you'll obtain in these type of cases. And you also look at things to figure out what was going on, how did this happen, such as all of the medical providers' schedules. How long had they been there? Was it the end of a long shift? Had they just walked in the door and been handed this patient? And also their personnel files, this repeated problem with them that the administration didn't address or didn't sit down and talk to them about. All these different pieces of information are puzzle pieces to piece together what happened here and why it happened.
And then, what are the potential consequences of medication errors during surgery, ranging, all the way from just minor reactions to a medication to potentially life-threatening complications? How are those addressed in a medical malpractice claim?
Yeah, I mean, first and foremost, the wrong medication can kill you. If you're allergic to it, or if it's contraindicated mixed with another medication, that result can be fatal. And even if it's not fatal, that can cause long-term catastrophic harm, such as brain injury, and even less catastrophic impact can cause you to take longer to recover, keep you in the hospital longer, even down to just causing discomfort, whether that be short-term or long-term, from having the wrong chemicals in your body that shouldn't be there.